Good afternoon, members of the press, and good afternoon, Bahamas. Today, we thank you for joining us again for the Ministry of Health COVID-19 update. As usual, we will begin with Minister's remarks. Minister Wells.
Good afternoon, members of the press, and good afternoon, Bahamas. Here is the latest update on COVID-19 in the Bahamas. On Thursday, the 12th of November 2020, there were 39 new confirmed cases of COVID-19. This brings the total number of confirmed cases in the Bahamas to 7,163. Total COVID-19 hospitalizations are currently on a downward trend and now stands at 23. There are 9 COVID-19 patients hospitalized in Grand Bahama's healthcare system. All of those patients are moderately ill, and at this time, there are no patients in the intensive care unit or ICU at the Rand Memorial Hospital. In New Providence, there are 6 hospitalized COVID-19 patients at Doctors Hospital. 4 moderately ill, and 2 are in the ICU. There is 1 moderately ill patient being treated at the South Beach Acute Care and Referral Center. At the Princess Margaret Hospital, there are 7 moderately ill patients with COVID-19. No patients are in ICU at PMH at this time. In all, there are 1,666 active cases, and 90 persons have been recently classified as recovered from COVID-19. This brings the total number of recoveries to 5,282, for a recovery rate of 73.7%. Fortunately, there were no deaths confirmed yesterday. Total number of confirmed COVID-19 deaths now stands at 155. Non-COVID related deaths are at 30, and 30 deaths remain under investigation. A total of 39,379 tests have been carried out for COVID-19 in country. 342 tests were performed yesterday, with 39 positives and 285 negatives. 18 tests were repeated to determine recoveries. Ladies and gentlemen, COVID-19 cases are steadily increasing in some of our family islands. During the Prime Minister's statement on Exuma, delivered this past Wednesday, he requested that the Ministry of Health report on the assessment conducted on the island of Eleuthera. During the period of the 31st of October through the 3rd of November 2020, the surveillance unit of the Ministry of Health visited the island of Eleuthera. The assessment team supported the local healthcare team and reinforced public health measures to slow the spread of COVID-19 on that island. The team conducted tracing and quarantining facility assessment on the island of Eleuthera. It also carried out a swabbing exercise, collected data about behavioral practices in Eleuthera, and conducted interviews with members of the community, including the island administrator, business owners, and the clergy. The team observed the following facts. The affected population of Eleuthera was relatively young. 23% of those infected with COVID-19 cases were between the ages of 30 and 39. Most COVID-19 cases were occurring in the central and south sectors of the island, and Eleutherans tend to socialize at bars, beaches, at church, or when attending a funeral. With these results in mind, the team made several recommendations. And consequently, the Ministry of Health is in the process of taking the following 7 steps to support the local team on the ground and the community at large. First, there will be an enhancement of the technological equipment and personal protective equipment available to healthcare workers on the island. Second, quarantine sites will be fully outfitted with a uniformed officer identified to man the same. Third, doffing and donning of PPE retraining will be conducted for the staff on the island. Fourth, efforts will be made to bolster the human resource on the island with additional contact tracers and persons to complete data entry exercises. Fifth, a health, education, and community outreach strategy will be devised to encourage adherence to the preventative measures and guidelines. Six, information will be disseminated on antigen testing protocols. And seventh, efforts will be made to liaise with other ministries to strengthen reinforcement to the preventative measures on the island. Currently, residents are generally complying with the new restrictive measures put in place to stop the spread of COVID-19. As highlighted in the Prime Minister's statement on Wednesday, another island where cases are climbing is Exuma. On the 9th of November, the cases in Exuma increased by 12 in one day. In response, the competent authority acted quickly to announce the implementation of a 24-hour weekend curfew, a weekday curfew from 6 p.m. to 5 a.m., and other restrictive measures to help slow the spread of COVID-19 on mainland Exuma. As of the 12th of November 2020, the total number of confirmed cases on the island of Exuma is 80. I am happy to report that an assessment team from the Ministry of Health was dispatched to the island of Exuma this morning. That team will meet with the island administrators, assist the local healthcare team on the ground, identify the local behaviors and practices, determine the geographical representation of COVID-19 cases on the island, inspect government quarantine sites, isolate the challenges and concerns, host virtual meetings to capture the concerns of the community, and recommend a way forward to control the spread of COVID-19 on the island of Exuma. The team will remain in Exuma until Wednesday. My fellow Bahamians and residents, after the island of Grand Bahama experienced a lockdown for more than 2 weeks, we saw concrete returns in the reduced numbers of COVID-19 cases. However, on Wednesday of this week, Grand Bahama recorded 38 new confirmed cases in one day. On further investigation, it was noted that 26 of these cases originated from employee interactions in the workplace. These employees work in the industrial sector as an electrical team. In the meantime, the Ministry of Health has moved to halt any potential further spread of the virus with the following corrective measures. Positive cases have been removed from the workplace and isolated. The surveillance unit continues to monitor the situation, and analysis of the data will be completed over the weekend to further assess any noticeable trends. My fellow Bahamians and residents, some islands of the Bahamas are currently under restrictions, such as weekend and weekday curfews, while others are seeing a loosening of these restrictions. We need to be mindful that these restrictions are not punishment. They are for the safety and well-being of the Bahamian people. The goal is to prevent the transmission of COVID-19 in the community. We want to save lives. The data has indicated that such preventative measures slow the spread of transmission in the community. Paramount of all preventive measures are personal responsibility. When you go out, ask yourself, am I 6 feet away from others? Do I have my hand sanitizer? Am I washing my hands often? Am I keeping my hands away from my eyes, nose, and mouth? Is my face mask on properly? And am I only touching items that I'm purchasing? We must not grow weary in well-doing, for in due season we will reap a reward if we do not grow faint. Continue to be disciplined and follow the protocols put in place to protect ourselves and our loved ones. Ladies and gentlemen, we turn our attention to our non-governmental partner, Samaritan's Purse, who has completed outstanding work to isolate and care for many COVID-19 positive patients at the Princess Margaret Hospital during the second wave of the pandemic in the Bahamas. The COVID-19 Isolation and Treatment Unit has been renamed the Special Pathogens Unit of the Princess Margaret Hospital. Last week, I advised that the operations of the Samaritan's Purse facility was systematically being handed over and placed into the capable hands of the staff at Princess Margaret Hospital. Today, the training 28-bed facility, 7 tents, medical equipment, personal protective equipment, and other supplies will continue to be used in the country's response to the COVID-19 virus. I would like to express gratitude to Samaritan's Purse, the non-governmental organization that willingly engaged in partnership with our country during a global pandemic. Again, I say, thank you for their Christian charity. We are certainly appreciative of the virtual infection prevention control training provided by Samaritan's Purse to more than 1,000 medical professionals. The virtual training was conducted in 36 areas on New Providence and 26 family islands. These new skills will certainly assist all participating healthcare workers to make the healthcare product more robust. Ladies and gentlemen, the Nursing Council's final examination for registration and enrollment was completed on the 3rd and 4th of November 2020. Candidates successfully passing this exam are welcome to the cadre of nurses in the Commonwealth of the Bahamas. 54 registered nurses and 2 trained clinical nurses sat the nursing examination. The examination papers are now being marked. At the end of the validation process by the cross-moderator and the external examiner, successful candidates who are interested will immediately be hired. This will go a long way to decreasing the current nursing deficit. It should be noted that before the pandemic, a study by the Ministry of Health indicated that 500 additional nurses were needed to make our healthcare system more robust. So as we wait the decision of nurses who have passed their examinations to enter the Bahamian cadre of nurses, the government will be paving a parallel track to augment the healthcare system by sourcing additional nurses from abroad. Ladies and gentlemen, a policy has been developed and ratified by the Ministry of Health's EOC for rapid antigen testing and will soon be disseminated to the public. The saliva direct test is being rolled out in Bimini, Abaco, Exuma, Eleuthera, Grand Bahama, and New Providence. I am happy to report that we anticipate using the test in the current mission to Exuma. We must prepare ourselves to embrace this new form of testing. With the recent passing of Tropical Storm Eta, it is also important that we remain prepared. Remember, we are still in the hurricane season, which officially ends on the 30th of November. Planning is an important tool for keeping you and your family safe in the event of a hurricane. Know where all of your important documents are, know the shelter location, and where you will stay if you have to evacuate. Always keep a few weeks of medication on hand and keep some water and non-perishable items available. Be sure to have your hurricane kit with essentials such as battery-operated radio, first aid kit, and flashlights. Furthermore, you should learn about safety before, during, and after a potential hurricane. It is noteworthy to mention that throughout this pandemic, our healthcare and frontline workers have demonstrated their courage, adaptability, and expertise. I wish to take a moment to again acknowledge this phenomenal group. We also remember our fallen heroes who fought valiantly alongside us with care and compassion. While our fallen heroes rest in the arms of the Almighty, may they never be forgotten. As our frontline workers continue to be a beam of light, and a ray of hope on this uncertain and ever-changing COVID-19 road, the collective can-do spirit of this workforce is appreciated. As the world lives through this pandemic day by day, we will ensure that our national response to COVID-19 continues to evolve to resist the virus. My fellow Bahamians and residents, as we enter the season of harvest and Thanksgiving, may God continue to bless you and your family, and may God bless this great commonwealth of the Bahamas. CMO.
Good afternoon again, members of the press and the Bahamas. I will now provide for you updates for islands, key indicators, and trends being monitored, after which we will invite questions from the media. Today, the technical team is composed of the following individuals. We have Ms. Mary Walker, we have Dr. Indira Martin, we have Dr. Philip Swan, we have Dr. DeLon Brennan, Dr. Nakia Forbes, and Drs. Jillian Bartlett and Dr. Frank Bartlett. The second wave of the COVID-19 epidemic in the Bahamas continues. To date, this wave has lasted over 131 days, compared to the first wave, which waned in less than 100 days. First slide. Cat Island and the Maikal grouping have remained COVID-19 free for close to 50 days. Since our last update, 247 new cases have been added to the total number of cases nationally. New Providence continues to have the greatest proportion of cases. However, the percent increase on some islands warrant concern. These concerns will be explored as we look across the islands of the Bahamas. Next slide. When we look at New Providence, the rate of increase has slowed, as evidenced by the shallow slope of the purple line. This is encouraging. However, we are not out of the woods as yet. Since our last update to you, New Providence has added 3 deaths, bringing this island's total deaths to 128. Of this, 94%, or 120, occurred in the second wave. On Grand Bahama, a total of 874 cases have been confirmed. This island had a 6-week period where its baseline new COVID cases was approximately 13. Over the last 4 weeks, however, the baseline has more than doubled, as you can see on the graph. We continue to monitor this trend and the impact of ongoing containment and mitigation measures by the Grand Bahama team. On Wednesday, the 11th of November, the Most Honorable Prime Minister spoke to the nation, announcing that due to an increase in total cases on Exuma, weekday and weekend curfews would begin effective the 12th of November. Explicitly, in less than 1 week, Exuma's total COVID-19 cases climbed from 43 cases to 80 cases. The Honorable Minister would have provided details of the team of persons from surveillance, communications, and health education, which left New Providence this morning and are now on the ground in Exuma to support the local health team in investigating the surge in cases on that island. They will also conduct educational sessions for the community. We note here the work of the National Surveillance Team, which, though small in number, has been the heartbeat of our response, working into the night 7 days a week from the start of the epidemic. These are the same officers drawn on to execute missions to islands of concern. We tip our hats to these soldiers, and we use this opportunity to remind every island community to be vigilant and to hold each other accountable for adhering to the public health measures. Turning to Andros, we now observe that COVID-19 cases extend from Nicholstown in the north to Kemps Bay in the south. We are monitoring closely what is happening on this island. On Bimini, contact tracing efforts discovered there was a large church convention on the island last week Sunday. To date, over 15 suspected COVID-19 cases are linked to that event, and we are awaiting the results of their swab test. Symptoms of one of these individuals were severe, enough to warrant being airlifted to New Providence for further medical management. To every Bahamian across the archipelago, such large activities represent behaviors that put individuals, families, communities, and our nation at risk. Congregating in large numbers at a church event, parties, social mix and mingles is too great a risk and can cost you and or your loved one their life. Our economy also suffers due to measures aimed at controlling the spread of the virus. The stories of Grand Bahama, Bimini, Exuma, and Andros send a clear message. This is no time to let our guard down. This is no time to become complacent. Growing up, my grandmother would always remind her grandchildren to stay out of harm's way. To you, those listening, watching, reading, this is no time to risk harm to yourself or your loved ones. COVID-19 is roaming, seeking whom it may destroy. When we look at Eleuthera, the mitigation efforts undertaken in Eleuthera are showing promise of containment of the COVID-19 spread on that island. Over the past 7 days, one additional death has been associated with Eleuthera, bringing the COVID-19 deaths on that island to 4. On Abaco, 180 or 1% of the population has contracted COVID-19 since its first reported case in July 2020. This island has an average of 1 case per day for the last 30 days. With no cases for the past 3 days, however, we continue to monitor the trend. When we look at all of the islands from the prior slides, we see clearly that the situation on each island is different. Though different, the public health measures to contain the spread of COVID-19 remain the same. Collectively, we must resist the temptation to gather unnecessarily, telework where possible, properly wear our masks, to cover our nose and our mouth, wash our hands frequently and sanitize. A collective commitment by all to practice all measures will result in fewer cases and fewer cases. The national weekly average of new cases stands at 31. This is an over 70-point reduction based on just before the tightening restrictive measures on the 9th of October. When we look at the crude R value, which we actually continue to monitor, the current infectivity rate, or R0, is 0.63, which has increased from the 0.55 value we reported last week. The Ministry of Health continues to monitor this indicator as a reliable retrospective view of COVID-19 spread within the community. An R north of 0 is ideal. So we continue to strive to maintain the decreasing trend with an R north of 0 as close as possible. When we look at the hospitalizations, we note that the rate continues to slow, and we are declining. Expressly, it has dropped 68% over the peak value in October 2020. Nationally, the average positivity rate stands at 17%. The Ministry of Health continues to remind the public that the real-time PCR remains the gold standard for testing, as it provides reliable results in both symptomatic and asymptomatic persons. Currently, 2 rapid antigen tests, the Abbott Pan Bio and the SD Biosensor, have been pre-qualified by the World Health Organization. These tests are reliable only for the symptomatic person. Testing and reporting requirements are now being incorporated into our national protocol. We continue to encourage all persons having symptoms to present for testing. Isolate while you wait for test results, and if positive, remain isolated until you are cleared. If negative, please continue to follow public health measures which will decrease exposure and the likelihood of becoming a case. Thank you, and we now entertain questions from the media. Kyle Walking.
Hi, good afternoon. Given what's occurring in Grand Bahama and what we've seen with islands like Exuma and Luthra, do health officials recommend tighter restrictions for that island? And why was it, I guess, necessary to enforce a lockdown on Exuma when your data shows that the cases are dropping there?
Okay, so certainly I would allow Dr. Frank Bartlett to give an update on the Grand Bahama situation.
Good afternoon. The cases in Grand Bahama, as you would have alluded to, would have been in the industrial sector. The teams that they would have had at the site, there was a project that was ongoing there now. They would have contracted infection from one of the persons who would have worked at the site. As you would have mentioned, they would have been quarantined. And the investigations that we have so far, we have all of those infections that we would have seen, or the positive cases that we have seen, localized to one area. Not only one area within the workplace, but one other area within that community. We're looking at the whole outlay as to what's happening in the community. We're gathering data, and one of the challenges we have right now as it relates to doing a proper analysis or to clarify more the situation that's what's going on in the community is that the data we have is a challenge. Not so much of a challenge because of the analysis, but because of the data and the information that we're getting from the persons who have contracted the illnesses. If we get inaccurate data from those persons, or we're not getting any information from them at all, it gives us really a challenge. It has a challenge. It can, oh God, it gives us a much more harder time to do the analysis and to come up with a clear picture as to what's going on in the community. The whole thought process now as it relates to Grand Bahama, and when we look at the clusters that we have on the island, the other cases that we have no explanation appear to be more sporadic as it relates to community spread. The areas where we have identified that there are an increased number of positive cases, we recommend targeted restrictions instead of having complete lockdowns. Because once we can identify those, hopefully we'll be able to curtail the increase that we're seeing with that, as opposed to putting our community in much more not so nice conditions with the lockdowns. Over.
Thank you, Dr. Bartlett. So to just add to that, certainly restrictions when we make recommendations would be based on what we are seeing on the ground and what we have been monitoring over a period of time. In Exuma, certainly, we began to see an increase as the slide showed. There was a significant increase in the number of cases over a particular period, and our recommendation related to what was happening on the ground. What we try not to do is have to run behind what we know the virus can do. The longer you wait to actually put measures in place to contain the spread of the virus, the longer it takes and the harder it is for us to actually have containment. So we would make recommendations as we begin to see certain trends occurring. And in Exuma, this was the case.
My second question regards to the travel protocol with international arrivals. So with the protocol of testing on day 5 of arriving in the Bahamas, just want to know, are people complying? If so, what are the numbers, and has anyone tested positive upon day 5 or even just after arriving in the Bahamas? Can we get an update on that?
Okay, Dr. Brennan, I think, is on the Zoom. I know he works directly with tourism. He may have those numbers. Dr. Brennan?
Yes, ma'am. Good afternoon. So to date, through yesterday, the November 1st through November 12th, there have been 5,584 applications for persons to travel into the Bahamas. Of that number, there were 2,492 residents, citizens, work permit holders, and then of that number, there were 1,842 who were registered as visitors that were expected to be longer than 5 days, and 1,250 who were visitors who were expected to be less than 5 days. So those are the persons who actually applied to come into the country. What we have a record of for those who actually traveled for the November 1st through 6th time period. So we can update on those numbers. So for what we can account for travelers for November 1st through November 6th, there were 1,691 travelers who traveled into the country. And of those, for the testing, we had there were 752 of that number who were compliant with the 5-day testing. And then there were 939 of that grouping who did not have testing done. Do remember that of that 939, that also includes persons who did not stay over the 5-day time period as well. So, there's more data gathering that will have to be done of that grouping to disaggregate those numbers. But what we can say is of the 752 persons who actually did get tested, there were 4 known positives. All of that information did come to the Ministry of Health through the portal that's been established by the Ministry of Tourism. Of those numbers, 1 person was a Bahamian, and there were 3 individuals who were work permit holders. And so all of those persons have been entered into our case investigation and contact tracing mechanism. Thank you.
Thank you, Dr. Brennan. Jimanita Swain.
Good afternoon, CMO. Good afternoon, members of your panel. Good afternoon, Bahamas. My first question, as it relates to, you spoke, CMO, to the number of cases that are increasing in Andros, in Grand Bahama, and 2 other islands. How will this, place a demand on the health resources that are already challenged or stretched as a result of COVID-19?
Thank you, Jimanita, for your question. Certainly, COVID-19 has placed significant challenges to our healthcare system. We are at a point now where we are having less cases, less admissions, but particular to the Family Islands, certainly New Providence is our hub. And as it relates to persons who become infected with COVID-19, we have to monitor those persons for symptoms. That places stress or excess, I would say, duties and responsibilities on the healthcare teams on the ground. And as these persons deteriorate, we then need to ensure that they are managed until we are able to actually bring them out of the particular island. And of course, that is at a cost. We have in place a system where we have air evacuation, but of course, it is a requirement for that process that you stabilize the person, and you have to wait until you are able to bring that person out. Dr. Bartlett continues to work directly with individuals on the Family Islands to ensure that this happens in a seamless way. I would give her the opportunity to add anything additional.
Good afternoon, Bahamas. Wayne, CMO. Just want to add and say kudos to the teams in those islands now that we do see an increase in cases. That being the team in South Andros, Camps Bay. That's been the team in Bimini. And we also continue to keep a close eye, of course, on Eleuthera and Exuma. So CMO, just as you said, once we have identified a case, The case that is symptomatic is presented to the clinic, or if the case cannot even come to the clinic, we actually do home visits and we go out. The case is immediately swabbed, isolated, and contact tracing began. So that's how we are operating on the islands to mitigate the spread of COVID on the island. And that's why we try to keep ahead of it rather than running behind it, so that the healthcare team is not further stressed in an already stressed environment. So that's what I'd like to add, and to say kudos to the team out there who continue to work every day to ensure the safety of the communities that they do serve. Over.
Thank you, Dr. Bartlett. You have a second question, Ms. Swain?
Yes, I do. Thank you very much for the response to the first. Now, I saw a recent report online that indicates that 1 in 5 patients diagnosed with COVID-19 within 3 months develop some type of mental illness, which could be anxiety or insomnia or dementia. What are we doing in terms of tracking within this second wave any of those mental health concerns? Are we concerned about that as we monitor what's happening?
Certainly, your question is very valid. As this whole COVID-19 pandemic evolves, many things come to our attention as it relates to the new science and new knowledge with respect to what can occur. In the mental health space, we have a mental health program that is actually managed from the Ministry of Health, and we have persons from SRC that participate in that. I will actually ask Dr. Swan if he is aware. He heads the mental health program in the Ministry of Health. If he's aware of any studies or any particular focus. Okay, he is saying no. So we have not started to track it as yet, but thank you for bringing that, thank you for that question. That will allow us to begin to see how we would be able to monitor those kinds of I would say, those occurrences after COVID-19 infection has occurred. Matthew Moxie.
Yes, good afternoon, CMO. My first question is for Minister Wells. Sir, I know at the last press briefing, you addressed the testing in the workplace. Now, if it is said to be illegal for employers to require a negative COVID test, then the question is, why is it lawful for government, I guess, to request the same? I imagine that both parties are trying to maintain the health of their environments. So if it is illegal for employers to request a negative COVID-19 test for employees to return to work, then is it not illegal for government to request the same, I guess, for travelers coming into the country?
Actually, no, it's not, because once the competent authority, the Cabinet of the Bahamas, would have issued an order to that effect, it becomes legal, because every order is a legally binding requirement for anyone who transverses the borders of this country.
Your second question, please.
Yes, my second question is, what are the criteria for schools to resume on-campus learning? I know it was reported that a school out west was given permission to resume on-campus learning. So what criteria is required for others to meet to be able to do the same?
Okay, so certainly we work closely with the Ministry of Education as it relates to the requirements for opening of schools. To my knowledge, you are referring to a school that I guess would have been given some permission, but we work closely with the Ministry of Education, and we anticipate having those discussions shortly to determine exactly the way forward. As we note in particular, the decrease in cases in New Providence and the need for ensuring that all school-age children are actually gainfully engaged in educational activities. So we are having those discussions with the Ministry of Education to determine exactly what the next steps would be for our schools. Tasper Ward.
Good afternoon. I'd like to piggyback on Kyle's question about Grand Bahama. I know Dr. Bartlett would have noted that all of those cases from Wednesday would have been linked to a industrial site. Does the same apply to the cases that were reported this morning? I see that 19 new cases were reported on Grand Bahama for November 12th.
When we received the cases, how we would have received the 19 cases, the disease surveillance team would not have had an opportunity to even evaluate those cases. We just would have received those numbers. We would have had an opportunity to look at a few of those cases and to identify where they were coming from. But the analysis and the exact details for those 19 cases that would have been added to the dashboard today are still unknown because they're being investigated. Over.
Well, can I just ask a follow-up, Dr. Bartlett? Based on the early analysis, can you say whether these are a cluster of cases or community spread from what you're seeing based on the preliminary data?
It's a mixture of both. And one of what I would have mentioned in the beginning, we have defined clusters within the different workplaces, but we still don't have a clear-cut explanation as for the ones that we are seeing that coming into the accident and emergency room. We would have mentioned 26 out of the 38 cases that we would have had on Wednesday came from an industrial association or an industrial site, but the other 12, we had 3 of those 12 actually coming from one of the gaming houses. We would have had another 4 of those that had no direct linkages to the workplace or any direct linkages to any of the cases that we would have had in the community. Out of the other 12 or 3 remaining, we had a challenge with the fact that we didn't have the data to actually contact those persons. And as we speak right now, we do not have or have not contacted those persons. So what we are in the process of doing now is trying to gather the data and the gaps that we have on those cases that we have not contacted. We are looking at our whole case profile from the beginning of our response to the COVID-19, looking to see if we can determine any type of linkages. With the volumes and the numbers we had, it was much more easy in the first wave because they were more manageable. We had more clear-cut linkages, and we could clearly say that it was sporadic in nature. With the ones that we have now, with the lack of clear-cut linkages, we cannot say. We do know that they are sporadic in the sense that they cannot be localized to one specific area within the Grand Bahama region, and they cannot be localized to one workplace. The fact that we don't, and we're seeing decreasing numbers, suggests that there may not be community spread, but we still need more data. We still need more analysis of the data that we have. We still need to gather the lacking data that we have to come to a conclusive answer and to give more clarity or have more clarity as to whether we have community spread. Because the important thing about establishing whether or not you have community spread is that going to be the determinant as to what type of restrictions you're going to be putting in place. Over.
Thank you. My second question, I know the CMO would have reiterated that the RT-PCR test remains the gold standard for the Bahamas. And in the last few weeks, there was a bit of a dip in testing numbers. Can anyone say whether that was a result of an increase in rapid antigen testing? And if so, what the rapid antigen testing numbers are looking like in the Bahamas?
Okay, so certainly to that question, that query has come to the attention of the ministry, and we are currently seeking to ensure that all persons or all entities that are seeking to conduct antigen tests are registered with the ministry. Similar to what we did with the real-time PCR verification and validation process, we are moving forward with inviting all persons who carrying out antigen tests or who wish to be a part of antigen testing to please make a request to the Ministry of Health in order for us to ensure that tests that are occurring on symptomatic persons are reported to the Ministry of Health so that we can actually carry out the necessary contact tracing. So to your question, short answer, we are being told that there are antigen tests occurring, and we are in the process of incorporating the antigen test into our national protocol. And as of today, we are asking all entities interested in doing antigen test to please make application to the Ministry of Health so that we can ensure that the national protocol is followed in order to prevent us from actually having testing going on without the necessary measures that are required after testing. And before I move on to the next question, I would wish to actually say to Mr. Matthew Moxie, I'm being advised by the minister that the schools to which you referenced were approved by the Ministry of Health and the Ministry of Education. Leandra Roll, sorry, Leandra.
Good afternoon. Good afternoon to all. I just wanted to get a little bit more information on those travelers who would have tested positive after arriving to the country. Are officials able to say which island did they travel to? Did those individuals had to undertake an RT-PCR test after testing positive via the rapid antigen test? Also, individuals who they may have traveled with on the plane, are they also being monitored?
Okay, so certainly the rapid antigen test on symptomatic persons will be incorporated into our national surveillance system as positives. As I would have alluded to, we are in the process of updating our protocol now to include that. I will ask Dr. Brennan to speak specifically to those persons who he would have referred to in his report.
Sure. Good afternoon. So the 4 cases that were identified were travelers in 2 islands. Those were New Providence and Grand Bahama. And so subsequently, those individuals were referred to the surveillance unit. They were all placed into the contact tracing protocol and ensure that we are collecting additional info from those individuals and making sure that anyone that they would have come into contact with during and finding out what their symptomatology is, who their contacts are, and carrying out that exercise. So that exercise is currently ongoing at present. And if those persons were exhibiting symptoms during their travel, then additional measures would be taken to address the persons who were traveling at the same time. But as far as we know at this moment, those individuals all had negative PCR tests prior to traveling, and they exhibited no symptoms during their travels. So their risk of having transmitted it during the actual travel time period is small. Thanks.
Thank you, Dr. Brennan. Second question.
Yes. Last week, Dr. McMillan, you had indicated that the ministry had received reports of unauthorized use of antigen tests on Eleuthera, and investigations will be conducted into those reports. Are there any update? Can you give any update on those investigations and perhaps speak to the ministry's efforts to crack down on those who may be issuing tests without being authorized?
Okay, certainly we Certainly, we did seek to determine exactly who and which tests were being used on the island of Eleuthera. And we were able to determine that the test being used is the test that one of the 2 tests that we know WHO has pre-qualified. So we are now in the process, as I have alluded to, of ensuring that those test results based on the protocol and for the categories of persons, i.e. symptomatic persons, which the test is actually to be used in, is the results of those tests are to begin to be incorporated in the national numbers. That is a protocol that we are updating currently, and we anticipate having that shared widely for persons who we will actually speak to the tests that we are actually, the two tests, the SD biosensor and the Abbott test that we will actually be continuing our ongoing verification on, that we will accept in country, as well as who could perform the test and also what happens with the test results. So long and short, we have explored the Eleuthera situation, and we are aware of the test that they are using. And we are seeking to incorporate the results into our national numbers as appropriate. Shamarko Lightbourne.
Hi, good afternoon. It's Marco Lightbourne from the Blaze 98.3 FM in Exuma. My first question, Dr. McMillan, Minister Wells, as well as yourself, would have mentioned that an assessment team just arrived in Exuma today, but is there any data for the island so far from local health officials that indicates if any particular area was or is a hotspot at the moment? I ask in hopes that this allows residents to make more informed choices, or should they just, use some retrospection and compare that to whether or not they have any current health anomalies?
Thank you for your question. Dr. Bartlett is following the Eleuthera numbers very closely. I'll ask her to speak to the numbers that we have currently.
Good afternoon again, and that's from Exuma, Marco Lightburn. So far, we have not seen any particular area in Exuma as a particular hotspot. It seemed to be widely distributed along the mainland. Mainland Exuma is the main focus right now, and consequently, that's why we had to put in those restrictive measures. So it's sort of widely distributed. There's not one area that's jumping out of us to say, it's a hotspot. It seemed to be distributed somewhat across that island. Over.
Thank you, Dr. Bartlett. And certainly we anticipate that with the team on the ground, we will be getting, like we did in Eleuthera, additional information with respect to, contacts. And with the swabbing that is ongoing, we will continue to update with respect to where potential cases, where the cases are. Second question, please.
Thank you so much, Dr. Bartlett. Dr. McMillan, you would have aptly called the surveillance unit the heartbeat of the country right now, and we know that they're an elite team, but they are very small. Can you give us an idea of how regimented their own safety and health practices are, not just only to sustain themselves, but also the work that they continue to do for the country, especially as they have to constantly jump into various places where we are having outbreaks right now?
Thank you. Very good question. Certainly the surveillance team has been a small team, and they have done astronomical work over many years with a small team, in part because public health, a lot of what we do tends to be in the background. But certainly as it relates to COVID-19 specifically, early when we started this whole planning for the response, we did extensive training, and the surveillance team would have been a key component and that we early on had training in as it relates to how to, put on the necessary PPEs, how to ensure that they protect themselves, and certainly we ensure that they are always supplied with the necessary PPEs as they continue to move about and do the necessary activities to conduct the surveillance activities. But if you ask me, I think we have a great need to enhance our capacities within the National Disease Surveillance Unit, and certainly with the spotlight that is on public health and disease surveillance at this time, we are using every effort to enhance our capacities, but of course that is not a one-minute thing. So as we are so thankful for those individuals who would have assisted with augmenting the capacities of that unit through contact tracing, volunteers, and those who have actually, showed up and assisted. We must always pause to say thank you to that core team of public health individuals who I know over many years, because I've had the opportunity to work with many of them over the many years. As one of them said early on, we are the ride or die people. And that is what public health requires. So long and short, we do our best to ensure that the training is ongoing as persons add to the team, and we continue to ensure that the PPEs are available. We try to take into consideration that they have lives outside of this COVID response. And certainly, be open to what is required for them to maintain their health as they take care of the health of the country. I hope that answered your question. Sasha Lightbourne.
Good afternoon, Minister. Good afternoon, CMO, and all other health officials. CMO, maybe this question can be for you or the Minister. We would like, or the general public rather, would like some insight, Nasuvians in particular, on the reversal, or I should say, the back and forth between the mandatory quarantine for Nasuvians traveling to other family islands. Initially, that particular restriction was lifted. As recently as, I believe, Tuesday night, there were some amended emergency orders which stated that that mandatory 14-day quarantine is now back in place. Can you give us any insight as to why the flip-flopping of that mandatory 14-day restriction with respect to Nasuvians traveling to different family islands, especially if a test is required, the health visa is required, if any Bahamian completes all of those steps successfully, why the 14-day quarantine being put back in place?
Minister will answer.
Thank you for the question. I believe the Minister of Tourism may have spoken to it somewhat. The reason why the 14-day quarantine actually remained in place was because the government, as you would well know, with the health travel visa had intended that once you would have taken the test, uploaded the information, that you would have been cleared to go to the family islands. The portion of the actual IT program that was scheduled for the family islands was not complete in its rollout. And you would have heard the Minister of Tourism spoke to the fact that today we're expecting that health portion for the family islands will be complete so that Bahamians would be able to access it, so that they would be able to move into the family islands. And hopefully, once that has taken place, then we're looking forward to seeing the issue addressed at the competent authority level.
If I may, Minister, with all due respect, I don't think that properly answers the question. It doesn't really speak to why the mandatory quarantine was initially let go after the requirement of the RT-PCR test, along with the health visa, and now it has been reinstated. It was only reinstated just Tuesday night with respect to an amended version of the emergency orders that was sent to the media.
Well, I think you would also be aware that all travelers coming into the country was required to do an RT-PCR test. And then once they would have arrived in country, they had to quarantine for 14 days before the introduction of the 5-day antigen test. So it was the fact that the government was putting the visa in place and the information in regards to the visa, that we removed the restrictions in regards to quarantine for those coming into the country. That was also intended for the Family Islands, but the system was not, had not yet been launched in a manner where we had worked out all of the quote-unquote bugs to where Bahamians could upload the requisite information so that there would be no quarantine for Bahamians moving into the Family Islands.
Thank you. My second question, CMO, I asked this question, I think it was a week ago, with respect to the antigen testing and facilities being able to offer these antigen tests. We now have Bahama has a secure date for opening, or date. Atlantis has announced a date for opening. How confident are you, CMO, with respect to those two large tourism facilities opening, with the large amount of Bahamian employees that they have returning to work, and what protocols are being put in place to make sure that not only the employees are safe, but tourists and visitors alike, even Bahamians who may choose to go and do a staycation, that they are safe as well? And how has the Ministry of Health even been consulted by those two entities?
Certainly, the Ministry of Health has been working closely with the Ministry of Tourism as it relates to the opening of hotels, relaxing the requirements for coming in, the change that you would have asked the minister about. So we are working closely with them, and certainly the opportunity to utilize antigen test to test as per the requirements of the test itself, or the recommended testing, will provide for us a level of safety as it relates to what is happening within the hotel itself. We anticipate that those major hotels will actually have health and safety officers, and in some instances they actually have healthcare providers that conduct this screening of the persons who are either staff or persons visiting the operation. So we are working closely with tourism and the hoteliers to seek to ensure that as best as possible, the risk associated with having COVID-19 introduced into the environment of, where we have tourists, as well as keeping our nationals safe as possible as they interact. We will be able to monitor what is happening in those environments through the testing that is actually being put forward. Dr. Brennan, like I suggested, is working a little closer with tourism. I'm not sure if he's able to speak to any additional measures that any particular hotel has put in place.
Good afternoon. No particular measures have been afforded to us here at the Ministry of Health and Ministry of Tourism. We know that there are continued conversations going on. So as these conversations develop and these dates get closer, I'm sure there will be more conversations and more collaboration with the Ministry of Health to advise on the appropriate approaches to ensure the health and safety of both the visitors, the patrons, and most especially the employees who are going to be working at those locations.
Thank you. Tyler Simonet.
Hi, good afternoon to the health team and to all who are listening. My first question is that on Wednesday, the PMH hospital administrator, Miss Mary Liburn Walker, she made it clear that the PMH morgue is still very much over capacity. I wanted to know, is the ministry considering taking legal action to push those families to pick up their loved ones? And also, if the morgue is already over capacity, is PMH experiencing any trouble storing those persons who were COVID-19 positive when they passed away?
Okay, Ms. Walker is here with us. I'll give her the opportunity to speak to the piece regarding capacity.
Good afternoon. Thank you for your question. We did indicate in the statement read that we are over capacity with respect to the number of bodies that we can safely store at the Princess Margaret Hospital. Nonetheless, we do have some additional capacity that we have had to put in place. And at this present time, we are able to store all of the bodies that are required to be stored. However, it is pushing it beyond capacity. The morgue actually has an official count of 52, and we're well over 200. Thank you.
And just to reiterate, this is a problem that we've been experiencing for quite some time. I remember on September 14th, speaking to the press regarding this, and I had encouraged the funeral home operators, those who've already been tasked and paid to collect the remains of loved ones, to come and do just that. And if they did not do such, that the government of the Bahamas would begin to charge the fees that is supposed to be charged in those instances where the remains of loved ones are not collected in a timely manner. And we will do that in order to facilitate the more rapid movement of individuals being interred in the manner in which they should be by their loved ones.
You have a second question?
Yes, I do. Thank you so much for that response. My second question is in regard to the new saliva testing. I wanted to know is, can we expect the new saliva testing to be on the same standing as the RT-PCR test when it comes to travel? Will people be able to travel with this new test instead of the RT-PCR, or will the RT-PCR still be required even if the saliva test is taken in?
Okay, we have Dr. Indira Martin here with us. I'll allow her the opportunity to speak to that.
Good afternoon. So the saliva direct test is actually a real-time PCR test. It's just one that's that is based on the saliva sample rather than the traditional nasal swab that we use for RT-PCR currently. So with that, once you get a positive result with the saliva RT-PCR, you can use that as you would an NP swab. Thanks.
Karen Bain.
Yes, good afternoon, Bahamas. Good afternoon, Ministry of Health team, and good afternoon, Minister. My question is for Dr. Nakia Forbes. Dr. Forbes, from the onset of the COVID-19 pandemic, have you seen a mutation of the disease from when it was first reported in March? And if so, what treatment method is the Ministry of Health implemented to continue its fight of the disease?
Good afternoon. Thank you very much. So at this time, scientists have been monitoring what's happening with COVID-19 and whether or not there are mutated strains. And indeed, there are mutated strains. There is some ability to test for strains in some labs in the Bahamas. We haven't detected any of those mutated strains. Scientists are also monitoring to see what about these mutated strains? Do they confer anything different? Are they more infectious? Is the disease course any different, more severe? And that's being monitored. It's not known that that is the case at this time. It hasn't been proven. And so the treatment for COVID-19 remains the same. It's generally supportive care, and it goes based on best quality expert recommendations with studies going on about available therapeutic agents. And so the short answer to your question is there is no knowledge we have of the impact of those strains or whether or not anything would be different. But thank you.
Thank you, Dr. Forbes. Second question, please.
Yes, thank you very much, Dr. Forbes, for your response. My second question is, with the number of COVID-19 cases on a decline, especially in New Providence, when can we expect for travel restrictions regarding testing for New Providence travelers to be lifted?
That's a very good question. Certainly, what we would hate to happen, as we see occurring now, is, we are on a decline in New Providence, but relaxing those restrictions too early, I think may result in introduction into islands where we have absolutely no COVID, or islands where we have managed to actually contain what is happening. We will continue to monitor the decline, and certainly as we see that we are at a point where, the risk associated with moving between islands is minimized, I don't think we will be at zero. We certainly will make recommendations to relax the restriction of testing. But for now, we continue to have that requirement because we have concerns with respect to wider spread across our family of islands. Elizabeth Bryan.
Oh yes, good afternoon, CMO McMillan. Good afternoon, Bahamas. Good afternoon also to the Minister and the rest of the Ministry of Health team with the Eleuthera newspaper. The first question is, Eleuthera mainland began both a weekday curfew and weekend lockdown state on Monday, November 9th. The recommendations made by the Ministry of Health assessment team during the previous week in response to rising cases throughout the Eleutheras. Substantial feedback received indicate that evening curfews were generally expected to mitigate the spread. However, the weekend lockdown was thought to be a crippling decision, negatively impacting any resurgence of tourist arrivals for the remainder of 2020 and the local economy in general. Can you share what specific indicators will be used to recommend the easing or lifting of, at least, the weekend lockdown in mainland Eleuthera? And what time frame was envisioned for these restrictions?
Okay, certainly the indicators that we monitor as it relates to, new cases declining, the deaths, whether or not we are having to actually, we have people presenting who are very ill and needing to come out of the island, hospitalized cases. Those are the indicators that we will continue to monitor with respect to whether or not the restrictions that are in place have actually, for want of a better word, broken the chain of transmission. So we continue to monitor the same indicators that we monitor across New Providence and other islands to determine, make recommendations as it relates to either relaxing or putting in place more restrictive measures. So those are the things we're monitoring for Eleuthera.
So just as a quick follow-up to that question, the second part, in terms of, was there a time frame envisioned for those restrictions on the island, especially the weekend lockdown?
I wouldn't say that I can give you a time frame. We would be, certainly we are seeing some decline. And as we continue to monitor the trend, certainly I can't remember how many days we are into that restrictive measures now, but generally we monitor it over at least one incubation period to determine what is happening. And ideally we may like to see 2 incubation periods, which would be 28 days. But we will certainly, I would say to you that the restrictive measures, when we make recommendations for those, are not done without the consideration of the discomfort, the impact on economy. So we will continue to monitor those measures and make the recommendation as soon as we are able to relax the measures.
Thank you. Okay, so for my second question then, the Prime Minister indicated in a national address this past Wednesday that according to the Ministry of Health's assessment team, which visited Eleuthera early in November, they had witnessed a general non-adherence to recommended public safety health measures on the island. The business community on the island responded, saying that local businesses have been widely compliant with recommendations like distancing markers, hand sanitization stations, door signage, mask enforcement, and even temperature checkers at some of the stores. So was the assessment team referring to private social gatherings or individuals seen while traversing public spaces while on the island? Basically, is there any more specific information as to the nature of the non-adherence seen on the island so the public can take note and be better informed?
Okay, certainly, I think it would be good to have that level of detailed information shared with the community. I certainly do not have it in front of me now, and they would have provided a report that spoke to those key observations that we would have provided, and as it relates to making the restrictive measures that we put in place. I'll allow Dr. Bartlett, who works, like I say, closely with the team on the ground in many family islands, to add any additional insight that she may provide with respect to specifics as you are asking for. Dr. Jillian Bartlett.
Yes, good afternoon, Ms. Bryant. What the team has been seeing on the ground there in both North Central and Southern Lustra are residents who are non-compliant. For example, if they go to a bar, they would hang out, nobody wearing masks. When they go to the boat to collect their stuff, no mask, no social distancing, and that sort of gathering. That's what I can tell you that the local healthcare team are seeing as they move around the island of Eleuthera. But I can't really say more as to the businesses and if they are doing what they're supposed to be doing when persons do come into their facility, etc. But I can tell you it seems to be just the residents and how they move about in the community with the non-adherence to the public health measures. Over.
Thank you, Dr. Bartlett. Sloan Smith.
Hi, good afternoon, health team. Good afternoon, Bahamas. Hope you guys are doing well. My first question can go to the minister. The Prime Minister would have advised in his latest address that as we see loosening of restrictions, cases are expected to climb again. And even now, as we are seeing a decrease in hospitalizations, there was once a point where the healthcare system was debilitated. My question is, can we get an update on the P3 discussions and any other plans the government currently has to build more capacity given the reopening of hotels and the restart of the tourism industry?
Certainly, we do have a very aggressive infrastructural program in the Ministry of Health. We are looking to continue our renovations at PMH with a couple of wards. We're looking to bring on stream at least 2 wards. In regards to PP3s, I don't want to speak specifically to those that have been proposed without the decision having been taken to actually move forward with those. But the government of the Bahamas is aware of a number of public-private partnerships that individuals are seeking with the Ministry of Health with the government of the Bahamas. We have a very aggressive program infrastructurally in Grand Bahama with the renovation of the Rand Memorial Hospital. And so we are preparing during this lull to create as much more bed space as possible and to lay a foundation not just for COVID and this pandemic, but for future pandemics, and to basically enhance the overall healthcare apparatus in the country to be able to address any issue that we see in future.
If I can just get a follow-up on that, sir. I know we're expected to see the facility in Grand Bahama be completed very soon. How soon can we see those wards at PMH being completed?
Well, I will get back to the general public at our next update. Specifically with timelines, I usually do update the public with timelines in regards to when wards would have been completed, and so we will do so at the very next news conference. We will update you as I used to do in the past in regards to just timelines for completion.
Okay, great. And my second question is also for you, Minister. The Exuma MP is now offering free COVID antigen testing on the island as we see a spike of cases in the island. Is the government currently considering or minded to partner with the private sector to offer similar programs on other islands in the capital, and why not? If it's not.
The Ministry of Health has some very strict and laid out protocols and guidelines for testing. And we're going to see to it that those protocols and guidelines are adhered to. We do have some testing going on within the islands in regards to the 5-day rapid antigen test, the RAT. But in regards to just testing in general in country, there are some robust protocols in place, and I would allow the health team to speak to the protocols that we do have in place for testing and reporting. We would like to discourage anyone just simply going out, purchasing any sort of COVID-19 tests, and then testing themselves or organizations or institutions doing so without being a part of the overall health apparatus, and without the additional requirement for the reporting lines of communication that are necessary for us to be able to adequately continue to address this COVID menace that we face in country.
Thank you. I think that was our last question. Thank you, Bahamas. Have a wonderful evening and a wonderful weekend.